Hello and welcome to the Medical Careers video on radiology. I'll start by asking, who are you and what is your title?
Hi, I'm Dr. Emma Owens. I'm a consultant radiologist.
And how did you become a radiology consultant?
So I did my house officer jobs and then I did 4 years of surgical training, one of which was in Australia. It was fantastic and I loved it, but I decided that from a work-life balance point of view, I wanted to do something slightly different. And during my surgical training, the radiology just was beginning to get slightly more interesting. So I remember the first MRI scanner going into Leeds, that sort of thing, which wasn't actually very long ago. But so when I started to do my orthopedic training and that we were doing MRI spines, somehow that just seemed really interesting. So I thought I'd apply for the training course, got it. And yeah, really glad I did, because it was definitely the right decision for me.
Oh, excellent. And what do you do on your average day, would you say?
So my day is spent almost entirely in an office. So I sit and I report imaging studies. So I don't do very much in the way of routine imaging anymore. So what I do is mostly incredibly subspecialized. And actually, because of that, it's usually pretty interesting. So most of what I do now is hybrid nuclear medicine reporting, along with specialist gynecological imaging. So I also do the preparation and the subspecialty gynecology MDT. So that takes up quite a lot of my time. I have other MDTs in endocrinology, and all of these require quite a lot of preparation, and they're probably the most interesting bits of the job, because that's where you get the interaction and the feedback on the patients as well that you've reported. Often I've got it right, but sadly sometimes not always. Sometimes I've got it wrong, which is never enjoyable, but incredibly useful from a learning point of view. Sorry, I was going to say the other things that I do that I've moved into. So I also do quite a lot of education for my radiology colleagues, because I run our radiology events and learning meeting, which is any discrepancies or good spots that come back to us, or just anything that is educational. And in those meetings also we can give cross-site policies and protocols an update, and we can discuss that sort of thing. I do that also nationally, where I'm on the committee for the national newsletter, and I'm also involved in a couple of other things, such as the British Institute for Radiology, their special interest group in nuclear medicine. So I helped organise them around the last SPECT-CT study day, which was an international study day, that one was. But most of what I do is reporting and preparation for MDTs.
Okay, you've spoken a little bit there about, the interesting parts of your job. Would you be able to give an example of, a day you would call your most interesting, or where something, exceptionally interesting happened?
No, not specifically, because most of what I do is, some of what I do is routine. I don't do much routine work anymore. Most of it is subspecialty. So most of it is actually what I've chosen to do. And so most of it's pretty interesting. Clearly some of the day is just the same thing and the same thing and the same thing, and that can get a little bit tedious, but almost invariably there is something that I haven't come across before every single day, I would say. And I've been doing it for 15 years now, and I still find something that I don't know about every day. So it's usually pretty interesting.
Good answer. And what advice would you give to someone looking to get into radiology?
So the first thing I would do is to make sure that you're actually interested in it. So go along to your local department, have a chat with someone, and do a taster day, week, whatever you need, because it definitely isn't for everybody. I was really worried when I left surgery that I would miss the patient contact, but actually there's an awful lot of patient contact, or there can be an awful lot of patient contact if that's what you choose to do. I actually haven't. I've chosen not to have much patient contact, which really surprised me, but I really enjoy it. But go along, because there's a wide variety. Do some taster days and see whether or not you're interested. And if you are interested, then there's loads of online resources that give you the information that you need, but definitely get involved in an audit. We've got loads of audits going on if anybody's interested in helping out. Yeah, I think that's probably what I would do.
Oh, thank you. And finally, why should someone choose to work in radiology?
Mostly, I think, because it's really interesting. It's genuinely mostly very interesting. Some of what you do is quite tedious and repetitive, but most of it's interesting. And also, you do end up with a much better work-life balance. You can, if you want, report from home, although I wouldn't do that. I personally prefer not reporting from home. I much prefer being in the hospital and having some interaction with colleagues. But otherwise, it's a really good career for its interestingness and its work-life balance. I think they're the two main reasons.
All right. Thank you for answering my questions, Dr. Owens.